So the three outcomes of complement activation include cytolysis, opsonization, and inflammation. Now let's take a look at what that might look like for a microbe when there is a membrane attack complex that was drilled into its surface. So here will be a normal cell, normal bacterium, here a nice rod-shaped bacterium, and here you have bacteria that are having their contents leaked out, they're completely destroyed. So that will be the result of complement activation, that MAC complex. Here in a diagram, the three outcomes of complement activation, you have cytolysis, which forms this membrane attack complex that then lets the contents leak out of the bacteria. Then you have the opsonization, which is basically a labeling mechanism that helps a macrophage or a neutrophil to find its target better and easier, and so the phagocyte then has an easier time to engulf the bacterium and internalize it. Inflammation enhancement mostly relies on the release of histamine from mast cells, and that enhances all the inflammatory processes that we talked about. So you get enhanced redness and recruitment of phagocytic cells, and the swelling and some pain will probably also come in, and so the typical inflammation process. Okay, so here the inflammation stimulated by complement. Here you have the mast cell and basically the C5a component of complement will bind to the C5a receptor, and then basically you have these histamine containing granules that are being spilled out, and here's all that histamine coming out and enhancing inflammation. C3a also plays a role. And here then you have the phagocytes, the neutrophils, they are being attracted sort of to the area. And here to finish up with complement, let's take a look at how complement is turned off. So basically there are some regulatory proteins that break down complement proteins and then thereby minimizing whole cell destruction. There's also some association of complement and disease. If you lack complement proteins or your complement system doesn't work properly, then you're more susceptible to infections. And some bacteria, they have learned to evade the complement system. Those are mostly the ones that have capsules, because capsules prevent complement activation. And our final topic here for this lecture on innate immunity is interferons. Interferons are the cytokines that are produced by cells. They have antiviral activity. Basically, the purpose of interferons is that they're being released by cells that have been invaded by a virus. And now this cell has been infected and it's been reprogrammed to make more virus particles, but it wants to send a message to its neighbors and say, hey, I'm infected, nobody can anything do for me anymore, I'm gonna produce more virus particles, but you can protect yourself from viral attack, and so you need to guard yourself. So basically interferons are messenger molecules that are sent out by distressed cells that have been virus infected to neighboring cells to protect themselves. And we have interferon alpha and beta. They're produced by cells in response to these viral infections. They cause the neighboring cells to produce antiviral proteins that inhibit then the viral replication. Interferon gamma causes neutrophils and macrophages to kill bacteria. Interferons have been studied for a while, and there was this great hope that maybe interferons would be the miracle medicine for viral infections like the antibiotics were for bacterial infections, but it hasn't turned out that way exactly. So here is the antiviral action of alpha and beta interferons, as you can see right here. We're starting out here with some virus, and it has viral RNA in this case. There's some infecting virus. It's getting into this cell. It's infecting this particular cell right here. And now the virus replicates, and in response, this infected cell starts the transcription translation of alpha and beta interferons, basically thinking, well, I have been reprogrammed, I'm infected, nobody can help me anymore, but maybe I can help out my neighbor. And so now these, the alpha and beta interferons, they're being sent out by this distressed infected cell to the neighboring cell, and they tell this cell, hey, viral particles are coming, guard yourself. And so now the alpha and beta interferons, they will cause this cell, this uninfected neighboring cell, to transcribe and translate antiviral proteins. And these antiviral proteins, once the virus infects the cell, they will destroy the viral RNA here in this case, and then they will inhibit viral replication. Viral replication inhibited, and thereby this cell can be saved. Now this one, it cannot be saved. So people thought if we can just have alpha and beta interferons available as a medicine, then we should be able to cure all viral diseases. And it turns out we can use biotechnology to make alpha and beta interferons, but for some reason it just doesn't work the same way as your body does it when it's releasing these alpha and beta interferons to neighboring cells. So it's probably a delivery issue, because you won't be able to get it exactly to the tissue where you would need it. And so there's some questions around that, but unfortunately the big hope that alpha and beta interferons would be our cure-all for all viral diseases and we wouldn't have to deal with viral and diseases anymore, that has not panned out. On the other hand, it actually helps, together with other antiviral medicines, it can actually really help. Now here a short word about iron binding proteins. So pathogenic bacteria, they basically need a good supply of iron for their growth. And in order to obtain that iron, they basically need to outcompete the sources of iron that the human body has. And so let's take a look at this. So in the human body, most of the iron is bound to hemoglobin. Then there's also some bound to ferritin, found in the liver, spleen, red bone marrow, and then lactoferrin in milk, saliva, and mucus, and then transferrin found in blood and tissue fluid. So somehow these bacteria, they need to find a way to rip some of the iron off of the natural sources of iron where it's bound in the human body. And so they can produce, the bacteria, especially pathogenic bacteria, they can produce siderophores that will compete with these iron binding proteins and basically rip it off the ferritin or the hemoglobin or lactoferrin for their own growth. And of course that is a mechanism of pathogenicity. And here our last component of the innate immunity that we have are antimicrobial peptides. They haven't been discussed for very long, but they seem to be pretty important actually, and it seems to be maybe a new way of making new novel antimicrobial substances, mostly new novel antibiotics they're talking about. So the antimicrobial peptides, those are short peptides, so composed of amino acids produced in response to protein and sugar molecules on microbes. They inhibit cell wall synthesis, and it makes them just like penicillin and other antibiotics. They form pores in the plasma membrane, and they have a broad spectrum activity. They were actually also discovered in the skin of reptiles and amphibians, and it's kind of amazing when you do surgery on a frog, for example, which I've done, and you just suture them up after the surgery and just drop them back into a murky bucket without worrying about it. And the reason for that is that they have this great antimicrobial activity in their skin, and that seems to be these peptides. So recently people have been studying antimicrobial peptides and to see for the potential of novel antibiotics. But this concludes our discussion of innate immunity.